Hi everyone. We'll just keep letting people in as they come in. But morning to all of you, and thank you very much for joining us for this session. We're very excited. We hope it will be a useful session for all of you. So before we kick off, just a couple of bits and pieces that we wanted to run through. So a little bit of housekeeping, just standard Zoom etiquette. So just keep in mind that this is meant to be a safe space, so everyone should feel comfortable sharing their ideas, their experiences. If you don't feel comfortable at any point speaking up, feel free to post something in the chat. We'll be using some other bits of tech, so hopefully, through different methods you feel happy to share. Please also stay muted during the session if you can, unless you're asked to unmute yourselves, and there'll be moments for group discussion where we will ask you to do so. But in the meantime, if you could just make sure that you keep yourself on mute, that would be great. If you're also able to rename yourselves with your name and the organization that you're from, that will just help others in the group also kind of see who's on the call and where we're all coming from. Finally, just to note that there will be some time dedicated at the end for questions and answers, but if you do have any points that you'd like to raise throughout the session, or anything comes up that you feel you just want to share, do post it on the chat, and one of us will do kind of our best to answer throughout or pick up on it at the end. But please do kind of feel free to keep posting throughout the session, and don't feel like you have to wait until the end. And finally, just to note that the session will be recorded and available through Emma and the team after the conference. So if you don't feel comfortable being recorded, you shouldn't be on the recording no matter what, but just turn off your camera maybe just in case, and change your name if that's something you're not comfortable with. And we'll also be sharing the slides afterwards, as well as kind of making ourselves available for any questions or follow-ups afterwards. So we're here for any questions or needs that you might have afterwards. So a really quick round of introductions from us. So I'm Raquel, I'm the External Engagement Coordinator at THET. So working very closely with Summer and Zara, who will introduce themselves in a second, on all things gender equality and social inclusion. So Summer and I co-chair our internal working group, and we've been supporting a number of different projects with gender equality in particular, but also social inclusion across the organisation, really pushing to mainstream it across all of our work. And hopefully some of the lessons that we've learned along the way we can share with you and will be valuable to your organisations as well. So I'm just going to hand over to Summer for her to introduce herself.
Morning everyone, thanks for joining. As Raquel said, I'm Summer and I'm the Communications Officer at THET. And I'll just hand over to Sarah now.
Hi everyone, I'm Sarah and I'm the Monitoring, Evaluation, Learning and Policy Officer at THET. Thank you for joining.
Great. To get us all thinking about the session this morning, we wanted to ask you to just have a quick reaction of what gender equality and social inclusion mean to you, and post a couple of words, 1, 2, 3, in the chat with what that makes you think of, what that makes you feel, and what you associate gender equality and social inclusion with. So we'll just give you all 30 seconds to have a really quick spontaneous reaction to that, hopefully. Great. So we're seeing some come through: representation, needs, equity, definitely fairness, equal opportunity, valuing difference, everyone equal always. That's great. Need to get that in our messaging. Meaningful participation, respect, absolutely. Equity, leaving no one behind, great. And thank you everyone for changing your names as well on there. It's really nice to see all the different organisations. Quality, inclusion, great. We just want you to keep that in mind as we go through this session, to think, what this means for you and for your organisation, essentially, because it does mean obviously different things in different contexts. So we just wanted to get you thinking about that and making sure that you keep that in mind throughout the session. So if you keep having thoughts, feel free to keep putting them in the chat, and we can kind of look at these at the end as well. But in the meantime, we just wanted to run really quickly through the aims for today's session. So we divided it up into kind of 3 key things that we hope you'll all take away from this today. So the first one is about how we think after this session. So we hope that after today, you'll be thinking about GESI throughout the project lifecycle when designing your project. So really making sure that from the moment you start considering putting together a proposal all the way to an evaluation, you're considering gender equality and social inclusion. And different organizations might be at different stages with this. That's absolutely fine. We just want it to be something that's present and a constant in the way we think about our work. Secondly, we hope that you feel more confident considering gender equality and social inclusion in your projects, so that you feel more equipped, you feel like you have more tools at your disposal, more resources that can support you in making your programs more inclusive. And thirdly, we just hope that you'll be able to engage with these resources and learn more about the topic, because we're obviously not going to cover it in an hour. So, you know, it's also up to you guys to then go out and look at those resources and make use of them and familiarize yourself with them, maybe share them with your teams. So that's one of the kind of key actions that we hope you'll take away from today. And just really quickly, before we go into this poll, I was just going to really quickly run through the kind of structure of today. So we're going to start off with some kind of key concepts that we think are, the main things that we want you to take away in terms of helping you with that design of projects. We'll introduce you to THET's GESI Toolkit, which hopefully you've received a link to. If not, I'll put it in the chat now. And then we're going to go into a group exercise. So we're going to go into breakout rooms and try and workshop through a couple of case studies to just get ourselves in the mindset of how this would happen in practice. And then we'll come back again and share and see how we've done with these aims. So on that note, I will hand over to Cymru now.
Thank you, Raquel. So before we jump into the main session, we do have a very quick poll just to see how comfortable you currently feel discussing and applying GESI concepts in your program. So I think Sarah is putting a link in the chat. Please be as honest as possible. There's no wrong answers, and we're all here to learn. So if the concepts are completely new to you, that's absolutely fine. I'll give you a minute or so to sort of submit your answers. If you're struggling to access it, just let us know. And we'll be running the same poll again at the end of the session, so we can reflect on any progress that's made or any sort of knowledge that's gained. Okay, we've had a few votes come through now. Sarah, does that mean if the ones, so the labels aren't there, is the one in the middle, does that mean fairly confident? I'm guessing.
Yes, this is just on a star rating. So
Okay.
Most people seem to feel like they're kind of 3 out of 5 stars.
Okay, great. Thanks everyone for taking part in that. So everyone's kind of in the middle. I think that's great. Hopefully today's session will just sort of refresh your knowledge, and it will provide you with a space to apply GESI concepts to practical examples. So I guess with sort of mixed levels of confidence, I think it's important to make sure that we're all clear on what is meant by GESI and what this means for health partnerships. So it's helpful to familiarise ourselves or refamiliarise ourselves with some of these key concepts at the beginning stage of the session. And as you can see on the screen, gender equality ensures that people of all genders have equal rights, opportunities and respect. So gender equality is the end goal of gender equity, and gender equity can be described as fairness of treatment for people of all genders according to their distinct needs and power. And it takes into account how benefits, costs and risks are distributed between genders. Social inclusion, on the other hand, describes a state in which vulnerable groups who are at risk of exclusion within a particular context, so this can be, for example, women, ethnic minorities or people with certain disabilities, are able to participate fully in economic, social, political and cultural life. And the term social inclusion describes the process leading to and sustaining a state of social inclusion. So now we move on to the next slide, and we can explore how these concepts are applied to global health projects and health partnerships more specifically. So what do we mean by a GESI approach? In nearly all countries and contexts to varying degrees, age, sex, ability or disability, race, ethnicity, religion, migration status, sexual orientation, gender identity, and there are plenty of other sort of social identities, have been and continue to be grounds for social exclusion and discrimination. So a GESI approach considers the unequal power relations and inequalities experienced by individuals as a result of these social identities, and looks at how the identities intersect with one another to create specific experiences of vulnerability and marginalization. A GESI approach focuses on actions to address these unequal power relations and inequalities, reduce disparities, and ensure equal rights, responsibilities, opportunities, and respect for all individuals. And these are very important considerations for health interventions, particularly to ensure that nobody is left behind. And that is something that somebody added into the chat box earlier. So that's great that we're already thinking about that. So we move on to the next slide. We want you to have a think about why applying a GESI approach is important. So we're going to ask you all to share your thoughts on Jamboard. We're sharing the link to the chat, Jamboard in the chat now. Yeah, Raquel's just shared it. Thank you, Raquel. So I'll just run you through how you use Jamboard in case you haven't used this particular tool before. I think it's fairly straightforward. You just add a sticky note by clicking on the middle icon on the sidebar on the left-hand side, and then you can write on your sticky note as Sarah is kindly demonstrating for us. And then you can choose your color and stick it onto the board. So if your note ends up covering someone else's, you can drag it into a blank space, and we can end up with a board covered in sticky notes. So yeah, I hope that makes sense. Just let us know if you're encountering any difficulties in terms of accessing it. And I'll give you a couple of minutes just to share some thoughts on why you think applying a GESI approach is important. It should be on board 2. Yeah, you can see some coming through for sustainability of impact. Yep. Yep, to remove power inequalities which continue to keep people in poverty, exactly. To make sure we reach the most vulnerable, no one's left behind, everyone's voice is heard. Yeah, these are some very key reflections. I hope you're all managing to access Jamboard, and we'll be coming back to this throughout the session, so it might be easier just to keep this window open if you can, but we'll reshare the link later on. Meeting the needs of the most vulnerable, yeah. That's great. Thank you. Yeah, so these are some really key reflections. It's fantastic to see them all coming through and being added. And if you think of any others as we move through the session, then feel free to add those. The Jamboard will continue to sort of automatically populate, so they'll stay there when we come back to it later on. So if we return to the PowerPoint, thanks, Sarah. We can have a look at some of the reasons why at THET we believe applying a gender approach is important. So as outlined in the Sustainable Development Goals, gender inequality and social exclusion are inextricably linked to social and economic outcomes and are the root causes of poor health and well-being. Globally, it's recognised that efforts to address gender inequality and social exclusion lead to long-lasting and sustainable change, and sustainability was something that we just reflected on in the Jamboard, so that's great. Unless vulnerable and marginalised groups are explicitly targeted and engaged within your projects, it's likely that they will not benefit from the project's intended impact. So therefore, a GESI approach is essential for the success of your health partnership and of global health projects more broadly. I'm just going to hand over to Sarah now, who will talk about how we go about applying a GESI approach in practice using THET's GESI Toolkit.
Thank you, Summer. So hopefully you have read a bit through the toolkit that was shared prior to this session. If not, no worries. I believe it's in the chat, but just keep in mind, we're only going to highlight the main areas of this toolkit, but it's a very, very useful resource, not only for health partnerships, but any type of global health projects. So I really advise for you to take a kind of deeper look into the toolkit and explore it and take some of the pieces that you think would be most appropriate for your projects, but I'll just touch upon some of the key aspects. So really the toolkit supports health partnerships to integrate a GESI approach by identifying entry points across all elements of health partnership work, which really includes project design and implementation, internal organizational structures and activity, and of course, monitoring and evaluation activities. So throughout the toolkit, we provide top tips for different entry points of your work and to really embed a GESI approach throughout the process of your project. So why did we create this toolkit originally? Really often in grant applications, we notice when we ask to explain how the proposed project addresses gender inequality, for example, applicants stated that the intervention is targeting women because they are targeting the nursing cadre, which involves a large proportion of women or who are working within services which target women, such as maternity services, for example. However, applicants should go further than this. The project should really seek to consider and address gender inequality by advocating for equal rights, responsibilities, opportunities, and respect for men, boys, or women and girls. And we really noticed that there was often a superficial attempt to address GESI within applications or projects. So we really hoped by providing a toolkit with really practical information and steps to have a GESI approach, we could strengthen and embed GESI from the beginning to the end. And also we use this toolkit for our own programs to really hold ourselves accountable and kind of see exactly what steps need to be taken to ensure this happens. So integrating GESI activities into project design and implementation, what does that actually mean? So unless vulnerable or marginalized groups are explicitly targeted and engaged within health partnerships, it's unlikely that they will not incur the project's benefits. So that's why we think it's very crucial that GESI is part of the project design. For example, that GESI is part of the rationale for a particular intervention in tandem with improving health outcomes. Something to keep in mind before beginning GESI activities is health partnerships, or in general, the project must gain support and buy-in at an institutional level, but of course within the community. It can be quite a daunting process, but the toolkit hopefully provides suggestions on how you might be able to do so. And this can be in the form of informal meetings or discussions, formal meetings using evidence, personal stories to really hone in on that GESI approach and why it's important to take this approach. And the toolkit really provides those top tips on ways in which you can, which senior management can actively support GESI and what stakeholder engagement and gaining buy-in at a community level looks like. And so you'll also find in the toolkit within the annex section, a range of tools such as an indicator sheet for all the monitoring activities and a GESI action plan, checklist. So I really, again, suggest you look deeper into this toolkit and use the different resources that are provided. But now going into kind of what GESI integration activities can include, that can be in the form of a GESI needs assessment of the context. You can identify relevant GESI related activities and integrate these into your projects. It can also be establishing processes for identifying groups at risk of marginalization, vulnerability, and exclusion, ensuring meaningful participation of key groups, and assessing activities against a gender responsive assessment scale. That sounds like a heavy term, but we're about to go a little bit more in depth in this scale, and I'll hand over to my colleague Cymru to guide you through this scale.
Thank you, Sarah. So yeah, as Sarah said, the gender responsiveness assessment scale is kind of a key tool within the toolkit, and this is just a screenshot from the scale, and it's used to measure the extent to which GESI considerations have been incorporated into projects and policies. So as you can see from the screenshot, there are 5 stages ranging from least responsive, which is GESI unequal, to most responsive, which is gender transformative. And you can see in the blue triangle at the bottom that GESI responsive programs cut across GESI specific and GESI transformative stages. So there's quite a lot of terms being thrown about there, but I will just explain what each of these steps mean in a bit more detail. So if your project is GESI unequal, it perpetuates gender inequality and other forms of inequality by reinforcing unbalanced norms, roles, and relationships. If your project is GESI blind, it ignores gender inequality and other forms of inequality completely throughout the project life cycle. And then we're moving towards the better end of the scale. So if a project is GESI sensitive, it considers gender and other forms of inequality, but it doesn't take remedial action to address them. So this could be, for example, a project that disaggregates data collection to include information on whether those who've been trained through your health partnership, for example, have any disabilities or what their gender is, but it doesn't sort of change the activities of the project based on the data that's collected. If your project is GESI specific, it considers gender and other forms of inequality and it takes action to address these inequalities, but it doesn't change sort of underlying power relations. So this could be, for example, a training course that's sort of multidisciplinary, but it gives a nurse a leading role as opposed to someone who's higher up in the hierarchies, for example, a doctor. But the project itself doesn't try to challenge hierarchies that are on the ward, for example. And then at the farthest end of the scale is GESI transformative, which is where all of sort of THET's programs aim to be. And these programs address the causes of gender-based and other forms of inequality by transforming harmful norms, roles, and relationships through the inclusion of strategies to foster progressive change within the power relation. So it all kind of comes down to power. So for example, this can be a project that seeks to improve women's access to antenatal care in rural areas. And to do this, it implements community awareness raising sessions with sort of gender specific or mixed groups to foster dialogue and address the imbalances that were creating barriers to healthcare in the first place. So again, these are all sort of quite theoretical, and I think what's helpful is to try and apply this scale to a case study. So that's what we're going to do in the group exercise now. So I'll just hand over to Sarah, who will explain this, but we're going to be going into breakout rooms. And if you're not happy to part, just the option comes up to join the breakout room, you can just decline the invitation and you'll stay in the main room.
Great. Thank you so much.
Sarah, do you want to just explain this?
Yeah, no problem. So group exercise, we're actually going to spend the next 20 minutes applying the GESI responsiveness assessment scale, like Cymru walked us through, using a case study example. You're going to find the case study on Jamboard. So again, maybe we can reshare that link and you can access Jamboard and it will be on slide 3 with the instructions. You will have a pop-up for a breakout session where you can think through this case study, and there's no right or wrong answers. And what we'll ask is that you nominate one person from each group to feed back when we get back to the main session, one highlight and one challenge of kind of doing this case study and applying this GESI responsiveness assessment scale. So again, if you can identify one person to feed back in the main session, that would be quite helpful, and we'll be using Jamboard. And so hopefully the exercise is useful and you can talk through kind of the different steps, and you'll see we'll be in each of the breakout rooms. So if you have any questions, you can ask. So you should have something pop up shortly to join the breakout session. I believe everyone is back. So thank you so much for participating in those breakout sessions, sharing your thoughts, thinking through the case studies. Hopefully it was a useful and practical way to kind of think on how you can apply this skill and the different tools and suggestions we've provided throughout this session. Now I will share my screen and share the Jamboard. And hopefully you've nominated a person per group to kind of feedback on a challenge and a highlight of kind of doing this case study and things that you came up with. So my colleague Cymru will take some notes on the Jamboard as you share your thoughts. I'll start, give me 1 second. We'll go here and I will start with group 1. Which I believe, room 1, sorry. So if that person can share, that would be very appreciated.
I think that's you, Jenny.
I've only just made it back in the room. Is everyone back?
Yes.
Oh, that's good. It took me a while to figure out the leave breakout room button.
Oh, no worries. I'll just recap really quickly. We're just, yeah, I'm sure you know, but if you can just share maybe highlights and challenges from the case study discussion, things that came up, and then my colleague Cymru will take notes as you speak on this Jamboard.
Okay. All right then. Do you mean highlights of good stuff or just highlights of general, you know, what we noticed?
It can be both, but yeah.
Right, fine.
Yeah, go ahead.
Throw things in a random manner. Okay, so we thought that it seemed reasonably good, gender specific maybe for GESI specific for gender issues, but not very good and a bit blind on other topics. And that fed through to, you know, the other questions as well, that, you know, other topics, other groups where didn't seem to have been considered, other GESI groups. We noted that things like the content of the training would be important and who put it together. And there were some concerns that it might be a bit tick boxy. It didn't perhaps sound maybe that it was obviously it's a case study. We don't have a full description of what the content might be, but it did come across as though it might be a bit basic. Who puts that together is important. And what it covers obviously is important. So also how sustainable it is, how likely is it to be something that makes an impact and is on the issues and is sustainable. We also talked about in terms of the assessment that was done, again, you know, some assessment done on gender, but not on other groups, seemed to be more qualitative. And it's important who assesses, it's important who does the assessment and whether there's representation from groups in doing that. We also noted that in some of the intervention taking place by mobile phone and WhatsApp groups, that as a mechanism of delivery might also have GESI access problems. We're fairly aware now that things like mobile phone access in particular is dominated by urban males, urban young males specifically. So again, that might also be a somewhat exclusive mechanism. And that's it, I think.
Yeah, thank you, Jenny. I guess not to put you on the spot, but what was maybe some of the challenges your group faced in discussion? Was there any or anything that really stood out to you in the discussion that you didn't already mention?
I don't think so, but others can chip in if they want to emphasize something or add something.
Yes, please go ahead.
Could you repeat the question? Sorry.
Yeah, so I guess just thinking through what challenges you face in the discussion when going through the different points, or if anything really stood out to you in the discussion worth mentioning?
Only that really we wanted a bit more information, and really we felt that there wasn't enough detail there to enable us to really review what was proposed. We wanted to see more about the impact or how challenging the training would be in terms of addressing the vulnerabilities and the inequalities that people are reinforcing with negative behaviours, and how that they could carry that forward through champions or peer support or negative behaviours that they actively discourage. You know, and we felt really that the whole thing lacked qualitative insight from across different groups within society. So really it had a gender component but nothing else. And then so the challenge was that we needed more information, if that makes sense.
Yeah,
we made a huge lot of assumptions which are generally not positive.
Okay, yeah, thank you so much, Hannah. That's really great. Okay, then I guess we'll move on to room 2. I believe that was my room. Not sure if I got any nominations for someone to speak up, but if you have anything to say, maybe a highlight, a challenge, please share, go ahead.
Who was in room 2, Sarah? I'm not clear what the room numbers are.
No worries. Yes, I don't know the exact names, but if I was not in your room, then you were
We were
in room 2.
Kit. We were 3.
We were 3.
Yeah.
Okay.
But if maybe I can move to room 3 while my room thinks about a highlight and a challenge. Maybe we can hear from room 3 some highlights and challenges. Please go ahead and unmute yourself.
Yeah, no problem. I mean, not a great deal to add on what room 1 have already said, apart from, yes, we felt that gender was somewhat considered in some bits, but other GESI considerations weren't, or didn't appear to be from the information that we had. We had a discussion around the needs assessment and the need to engage with the community and through community stakeholder engagement, not just at government and provincial level. And again, you know, as Group 1 highlighted, look at who is doing that needs assessment in terms of, you know, allowing people to be fully open and honest. Again, yeah, data is only disaggregated by gender and not other inclusion characteristics. And again, also the training only being on gender, and a question around whether gender awareness, gender equality awareness training is actually going to have the impact or create the change that they want to see. And yes, also again, you know, disseminating information via WhatsApp isn't very inclusive for people with different literacy levels. And obviously they consulted with the facilities management on where the training will be run, but not with the people that would actually be taking part in the training, and whether those venues would be suitable. So overall, we felt maybe it was gender sensitive, but certainly not GESI sensitive.
Yeah, really great points, Beth. Thank you so much. Yeah, would love to hear from anyone else, possibly from room 2. If not, if anyone else has any other things that came up, any important points that you would want to highlight and include this, I'll give you some time right now to think, and then you can unmute yourselves. Yes, Anne, I see you've put your hand up.
Yeah, I'm really struggling with the tech. I've sort of got a bit past the age where it comes easily. I felt that what we looked at was, and I'm talking, I you know, the jargon as well kind of floors me a bit, but that we were looking at what feels to me more like an academic exercise rather than one that had been rooted in, and I might be, and tell me, I might be being completely unfair here, but it has to be rooted in the experience of a place, and that is really difficult to do from afar. So I don't want to criticize people too strongly, because clearly it was a, you know, people were really well, you know, they were really well motivated and they were really trying, but I think what is lacking is local knowledge, really, perhaps.
Yeah, definitely.
And when someone talked about qualitative studies, I think that was another way of saying that, really.
Yeah.
You know, because if you're going to communicate with people, you need to know what their means of communication are, and not just talk about WhatsApp groups.
Yeah, definitely. Really great, valid points. And I don't think you're being unfair. I think you really allowed kind of key areas for improvements, especially the local context criteria, which is crucial for any of these to actually have a successful GESI approach. You would need to know the context, know who's being representative, whose voices are unheard, what kind of technology they can access. Extremely valid points. So thank you for sharing. Yeah, anyone else have points to share? This has been really helpful, and I think that was kind of the point of the case study. It's not a perfect approach. They've really started to think through the different aspects, and we can see there's always areas for improvements and kind of some key things to think through for each of those different steps. So I'll just give you maybe a minute or two. If you have anything else to say, feel free, unmute yourselves.
I was just going to say that I found it, without I don't myself have any in-depth knowledge of GESI, and I found it really interesting to see an example which on the face of it looked like a project focusing on at least gender, but looking into the detail of it, it's weak even on that and ignores the rest. So I think for me, that's been my learning.
Yeah. And I believe there was a chat from Alice. I can't really open my chat if you, yeah.
Dara, shall I read it out?
Sure.
Yeah, or I can.
Oh,
yeah,
go for it,
ahead.
Alice.
I can say it. Well, we talked about, even at the very start, it said about the THET team, you know, finding out this information. And one of our questions was that essence of, well, actually, who were that team and what representation did they have of the sort of GESI group? And that possibly goes into then Anne's comment of that hopefully there was a local member or a user of you know, as even part of that original sort of analysis in the sense of co-investigation. So yeah, really, it's been great. Thank you. And yeah, Anne, I think your comments really reflect across to some of what we said in our small group.
Yeah, thank you, Alice. And in terms of just the technology bits, I know we're actually, you know, trying out different tools, especially in this now virtual world. It can be quite hard for any age, honestly, to grasp these different tools. I know myself, I'm still learning. So apologies if you've had some difficulties. Hopefully, we're trying to find ways to make it interactive, because a lot of us are very Zoom exhausted. And so we thought, hopefully we can use some type of interaction. Ideally in person would be best, but just trying to cope with these times. But yes, just thank you so much, everyone, for participating in the breakout sessions in this session, sharing your thoughts. As we can see, GESI is a hard thing to do, but if you take the right steps and you work towards the different points and thinking of everyone involved, you can try to embed some type of approach. All right, so if I just want to put out one last call if anyone else has something to say, and then we can go back to the presentation. Okay.
Great, thanks, Sarah. And thanks everyone for participating. And great to have all that criticism. We did make it up in a way, so none of your comments are taken personally. We used a kind of semi-real life project, but then adapted it a little bit. So yes, all the criticism very welcome. And for when we're kind of redesigning our own projects, I think we'll definitely keep in mind some of the comments that you've made. So yeah, really helpful. And we appreciate that maybe you didn't have all the context you needed, but what we really wanted you to get out of this was to think through what you would have to think through in a way if you were undergoing this process. So not so much about that specific case, but, and as Sarah was saying, it's a journey, and it's not about getting immediately to the perfect way of doing it, because there was scope for improvement, as we all know. And it's about being flexible and being agile in the way that we program as well, to allow for these things. But yeah, just we hope that it's been useful in terms of thinking through the steps and having that critical eye on our own projects as well when we're designing. So on that note, we just wanted to go back really quickly to the session aims that we'd outlined at the beginning, and just ask you to take a moment to just think about, do you feel like you've achieved or you've come some way to achieve these aims? So are you thinking better about GESI throughout the project life cycle? Do you feel more confident in doing so? Do you feel like the discussion and hearing what other colleagues might, the way they might be approaching this, has that made you more confident in the way you approach it? And hopefully we've spurred your interest in some of our resources, which we'll re-share after the session. But hopefully, yes, we've created a little bit of space in your very busy days to have a moment of reflection on this, and you've come some way on this think, feel and do. So on that, we wanted to, and this is the last kind of ask I think that we're going to be making of you in terms of tech, we wanted you to think about 3 questions. So what went well today? So what parts of the session you particularly enjoyed? What learnings you thought were particularly valuable? Something that surprised you today, so it might have been something that someone said in one of the discussions, it might have been a concept, it might have been a resource, an approach, so something that surprised you today and something you'd do differently. So there will be kind of more formal feedback forms afterwards, I think, that Emma will be sharing, but just if you do have any feedback on the way that the session was run, but also it could be about what you will do differently after the session. So if it has spurred any kind of change, we'd kind of encourage you to think about that as well. And if you are able to just, kind of take a minute to think about those 3 questions. And then if you feel comfortable doing so, you can add onto the Jamboard. So there's a final slide or frame, sorry, I think they're called. So it's on frame 5. Sorry, I was just checking. Okay, great. So people are adding in already.
And if you would rather just write in the chat, if you've had enough of Jamboard, then feel free to do that.
Absolutely.
And we can move it across.
Absolutely. Yes, just seeing the comments now, which are really great as well in the chat. Okay, so we see the breakout rooms are well received, and please do be critical of us. We won't get upset in any way.
And just a slight tutorial again. Once you open the link and you see on top here, you're 5 out of 6, that's the slide you're on. On your left-hand side, you just have to click the one that says sticky note. The sticky note will appear and you write your thoughts down. And then you can move that, basically that little square, which is your sticky note, anywhere you'd like on those different categories. Again, if that's not something you're comfortable with, you can share it in the chat box.
Okay, so some really good comments coming through around the case studies and the breakout groups. Some really nice stuff in terms of what we do differently. So we've got, I will try to support groups in Wales to develop projects with a GESI lens. It's great to hear. Using the scale, great. Spending more time exploring the different intersections, absolutely. I think in kind of further sessions, and as we continue to think through this, it's really important, those points that Summer touched on at the beginning of the session in terms of how we think about intersectionality and that side of things, so definitely. Great. Well, while everyone keeps posting on there, we just want to open it up for any kind of final questions, comments, reflections about either any of the content that we share today or any other areas of kind of THET's work or resources that you might be interested in. And yeah, feel free to either unmute yourself, raise your hand, chat, anything. But just if anyone has any final either thoughts or questions that they'd like to share.
Can I just ask, it's Emma here, do you do, I mean, the toolkit's obviously quite a big document and it's got lots of tools that you can use. Do you do any other training or this kind of session where you actually show how you've applied those tools and maybe show like the journey of a program that has changed from being, for example, blind to moving up the scale? You know, if you've seen a journey of a program over the time.
Sure, yeah, that's a great question on that. So we do run some trainings for our volunteers, as well as for our health partnerships. Martin saying, Alice's message posting there that we've got a new program launched to build up the capacity of small CSOs. So yes, we definitely within our community do run kind of training sessions at different points for different audiences. In terms of the toolkit and how extensive it is, I think that's something we are conscious of because it is such a complex topic. It felt like it was necessary to have that bigger document. However, we are working on a simplified version, I guess, that will be available on Pulse. So that's THET's new community platform. Sorry for the plug here, that we will be launching very shortly, I think, and some of you might already have been invited to have an initial look. So on there, we're looking to draw out those kind of key messages from the toolkit and make it more interactive, so you can use it a little bit as a checklist, for example, and kind of point to key resources. So yes, coming up is essentially the short answer to that. I don't know if Sarah and Summer want to add anything onto that.
Yeah, I was just going to add something real quick. As an organization, we're also still working on trying to embed that within our programs. And one of our programs, the Commonwealth Partnerships in Antimicrobial Stewardship, CPAMS, which we ran in 2019, we actually understood from our evaluators that the GESI approach was quite superficial. And we really took that criticism and have now kind of used a really kind of comprehensive, hopefully, GESI approach for our next CPAMS program, which will be launched. And hopefully we can draw out some learning and share that with the rest of the community to see how well that we transform that GESI approach from the first round of the program to the next round of the program. And I also believe we're kind of carrying out GESI specific workshops with kind of other organizations who are more equipped in training, I believe, such as Change Exchange, to kind of deliver, or is it React? I'm not sure, but you can follow up with us on that. And hopefully that will strengthen a GESI approach with the partnerships that are involved in this program. So a work in progress for us as well, for sure. Yeah.
Great, thank you.
Great. Any other comments or questions that anyone wanted to make? We've got 5 more minutes. We've just got some wrapping up to do.
I just wanted to say how useful I found the whole session. So thank you very much.
Great, thank you. Really nice to hear that.
Just while we're talking about comments, and obviously we'll keep your comments from the chat and share them with THET. But I'm also going to put, you might feel a little bit over evaluated here, but we've got a survey which we're asking people to fill in about the summit, which you can put comments about the session as well. And is it okay, Raquel, if I launch the poll now, or do you want to wait a bit longer?
No, I think that's fine. We just wanted to, we won't overwhelm you with any more polls, but we just wanted to make sure that you all had to think about how confident you feel discussing and applying GESI concepts. So we asked you this at the beginning, and we just wanted you to have a think. Again, just trying to create a bit of reflection around how you feel you've met the aims of the session, if it has, improved your confidence on the subject. As Sarah was saying, I mean, it's definitely a journey, and we're very much along the journey as well. We haven't, we're by no means there. So yeah. Great. Okay, so we've got a few more 4s, which is good. Oh, 5. Great. And no 0s, or as in 1s or 2s. Okay, well, if you feel happy to, do keep kind of replying to the poll, because it's also really helpful for us in our learning in terms of these sessions. And yes, we just want to point out some of the resources that you can find in our website, and also feel free to get in touch. Our email addresses are on there. Alice also posted a general email address for THET on the chat. Emma has our contact details. Essentially, feel free to reach us one way or another. We're very happy to follow up with any specific questions. And yeah, just to say thank you very much, everyone, for joining, for taking the time, and yeah, and for showing up today. We really appreciate it. So on that note, I'll hand over to Emma.
Great, thank you. And I want to say a massive thank you to Raquel, Sarah and Summer for that session. Really interesting, great practical tools and insights for us to take away. I'm going to launch another poll. It's our standard poll for the summit, so I'm sorry to be asking you some of the same things, but I'll just leave that up for a couple of minutes. Yeah, and the session, we've recorded the session, so it will be on our website over the next few weeks, and we can share obviously contact details and the slides as well. And I think it's really good to be working with THET and to have this. I think the toolkit, when I saw it, it kind of stood out for me that it wasn't just, you know, the concepts and some of the tools that are there do apply not just to health partnerships, but we can use them in lots of other contexts as well. So I think it's a really useful, practical tool that we can use, and we'll be looking at it as Hub Cymru Africa as well. I'm just also going to put in the chat the obviously the summit's not over yet. We've still got the rest of today and tomorrow, so please do sign up for have a look at the programme, and there's more sessions coming up. I'm just going to leave the poll for another minute or two. And there's also some sessions that are coming up next week. Kit, do you want to just talk about those? You've got the one on the Pulse platform, haven't you? And
yeah, that'd be great. I was wondering when you mentioned Pulse, but I didn't want to overwhelm with information about things. So so I believe THET are launching the Pulse platform, which is a sort of online forum for health partnerships to connect tomorrow. And next week, there's a digital workshop specifically for Welsh health partnerships. It is on Thursday, I think. I'm just checking my diary. And the reason I'm checking that is because the following day we have another session. So next Thursday at 1 o'clock is Digital Wales workshop. That is advertised on the THET website, and I'm sure on the Hub Cymru Africa website. When I stop talking, I'll have a look for a link. And on the following day at 10 o'clock, there's a session for people thinking of applying for a THET grant. The small grants are open at the moment. One of the core themes that your project can fit into is GESI. So if you are thinking of applying for them, there's a separate webinar, again, specifically for Welsh Health Partnerships on Friday the 26th at 10 o'clock.
Great. Thank you so much. And thanks for everybody's time. Really appreciate it. And I'm going to end the session now so we can go and have our lunch. Thank you.
Thanks, everyone.
Thank you, everyone.
Bye.
Enjoy the rest of your day.